some 8 minutes past 8 o'clock here on 107.9 FM. Welcome and good morning to the Orange Health Lounge. As always, my name is Dr. Kwesi Jima. Welcome to the show that breaks down complicated health conversations into simple, everyday conversations for you to understand, ask your questions, and clear your doubts. Our show comes your way every Saturday from 8 to 10 a.m. here on radio and also live on Facebook. The Orange Health Lounge is brought to you by the kindest courtesy of Prime Diagnostics and Eye Care Services. Prime Diagnostics and Eye Care Services is located here in Kumasi at Bomso. And also brought to you by the kindest courtesy of Marie Stopes. My guests are already seated. Let's get into today's conversation. So today I have with me Marilyn Mausi Azuma. She's a senior nursing officer at Comfort Noche. She works at the D4 ICU. And I also have Dr. Harris Osei Mensah. He's a resident in internal medicine at the Comfort Noche Teaching Hospital. Later in the show, we'll be joined by Patrick Camilo. He was here, I think, a couple of weeks ago with the Spock Stroke Fast Foundation. But guys, welcome.
Thank you.
Thank you.
Right, it's good to have you here on a lovely Saturday morning. I think World Diabetes Day was on the 14th of November. Or it's on the 14th of November. I'm counting the days faster because I'm anticipating the World Cup. If you're watching us live on Facebook, I'm wearing my Ghana jersey. Where is yours? I mean, we're all supporting Ghana. Hopefully we go beyond the group stages. I didn't say that. Anyway, the theme for this year's World Diabetes Day is Education to Protect Tomorrow. And for those of you who have heard about diabetes and have some knowledge about diabetes, you already have a fair idea what our conversation is about. But if you've got a question that you want to ask us, our show is interactive. You can send me a WhatsApp on 0548 501 584 0548 501 584. We're talking about diabetes. And as much as possible today, we're going to try and do a mix of English and Chi. We're going to do some Chinglish. Because I think that from what I said, diabetes is so common, it's so prevalent, and most of the people or most of the clients that we see in the hospital sort of understand things a bit more better when it's in the local dialect, and they can also ask questions in the local dialect. In Janapawe, wow, question be for diabetes on, be what diabetes will be a chair wadrin so. Maybe a way will be what diabetes that or question be a person. Today we're going to mix it up so that we can have a well-rounded conversation. Yes, so let me start with you, Dr. Harris. Welcome to the show.
Thank you.
Great. So from where you work at Comfort Noche, how's the diabetes picture looking like?
Okay, so thank you for the opportunity to be here this morning. The picture globally, we've noticed that the incidence of diabetes is increasing, especially in the developing countries, mostly due to increased, maybe people are having obesity and then also lifestyle modifications. All these things tend to increase the prevalence or the incidence of diabetes. We have types of diabetes, fine, type 1, type 2, and then type 2 is more common.
So,
And type 2 is basically due to lifestyle modifications, obesity, and then even hypertension as well. So the cases are increasing. Unfortunately, that's the truth.
So like the picture, I mean, from what you said, it's more that we have more cases of, I think in hospital, Marilyn, correct me if I'm wrong, you're at D4. I think in hospital, I think one of the basic things we're doing for patients now is to check their blood sugar on arrival. That didn't used to be the case. At first, it used to be just temperature and height and weight and blood pressure. But I think now we've added the RBS check to it. Why? What happened?
So we've also realized that over the years, most people come in with So we've realized that over the years, most people who come in, due to the conditions that they have, when people are very ill, sometimes they are prevalent of they have a risk factor of getting diabetes. So sometimes it can be induced by certain medications too. And people with high blood pressures, most of the time, are at high risk of getting diabetes. Yes. So, I mean, checking their sugars when they come, because when you're very sick, your sugars could be up, and it could be due to either medications or the fact that you are very ill, or because of the infection that you are having. So we check, and as you said, most people in our country, are obese. So because of the diet and how we live our lives, most of the time our sugars are like over the roof sometimes.
Over the roof, okay. So, I mean, if you go to hospital, you're listening, you go to hospital and they want to check your blood sugar, it's pretty normal now to have your blood sugar checked when you go to hospital. It's also important because at the time of checking, you never know. You really, really never know. And I have seen many patients who were previously unaware that they were probably diabetic, and they walk into hospital to do something routine and then just found out. So you may go there with a cough, with a chest pain, with a headache, but allow the system to screen you. And, it's a small test. It's not
a tiny ant bite.
I'm not a needles person. So, I mean, it's a small, prick on your finger, and then it's a point of care device. Within a second, you get your result, and then you are on your way. So it's part of screening. So it's done in virtually every hospital that you go to. If there's something about diabetes that you are unsure of, there's something that you want us to talk about this morning on diabetes, you can send me a WhatsApp on 0548 501 584, and we will definitely clear it up for you. It's so common to hear someone say, I'm diabetic, or I'm on diabetes medication. Patrick, you're welcome.
Thank you.
It's good to see you again. Yes. Doing so much work for Spotting Stroke Fast here in Ghana and beyond. Is there any correlation between stroke and diabetes, though?
Yes.
There is?
Yes, there is.
I didn't know. Tell me.
Diabetes is actually one of the leading causes of stroke.
Oh, really?
Yes.
Usually when people hear that someone has a stroke, they think probably it's from elevated blood pressures or something else. But diabetes can.
The two actually predispose people to developing stroke at a very fast rate. So they expect that everyone should get checked and then get to know their status. Because once you have diabetes, it means that your chances of developing stroke is very high. Yes, so the correlation is there and it's clear. Yes.
I see. If you're just joining us, this is 107.9 Orange FM, and today we are talking about diabetes because, World Diabetes Day is in a couple of days, and you don't want to miss out on the conversation when it comes to managing your blood glucose levels. If you've got any question to ask, you can send it on 0548 501 584, and my guests are all experts across field, and they'll be able to tell you more about it. Good morning to all of you who are watching us live on Facebook. You can share the link if you're watching us live so that someone else can benefit from our discussion. But in general, like Doc, when people mention diabetes in general, if you want to break it down as non-medically as possible, which is always very difficult for doctors. I find it strange. Like non-medically as possible. When someone says that diabetes, then I look at that and say, oh, is that all it is?
Yeah. So when we say we have diabetes, we are saying that we have raised levels of blood glucose. Okay. And then there are so many causes of that. So it's as simple as that. When you have raised levels of blood glucose, mostly due to pancreatic issues. Okay, so the pancreas is an organ in the body that produces insulin. And then the work of the insulin is to make sure that the blood glucose levels are virtually reduced. Make sure that the body or the cells are able to take up the glucose and then metabolize it for energy, and then also use,
if I can call it that, of elevated blood glucose is not enough to say that the person is diabetic.
Yes.
Okay.
Yeah.
Okay.
So there's a criteria actually. So for patients who have symptoms, let's say the classic symptoms of diabetes, when they come in with unexplained weight loss, they have increased thirst, and then they are drinking virtually every time. They are also frequenting the washroom to pee, acimicturate, and also maybe they are eating every now and then. Okay. Maybe the patient tells you I easily get tired, and then maybe they complain of dizzy spells, blurred vision. For patients who have these classic symptoms, you need maybe one abnormal value of whether you're having a random blood sugar of more than 11, and then you have a fasting blood glucose of 7 and above. And then also when you do an glycated hemoglobin and it's more than 6.5% and above, that is when you can say that this person has diabetes confirmed. But then if the person doesn't have symptoms, like the person, there's nothing wrong with the person, he just comes to the hospital, you check the blood glucose level and it's high, maybe more than, the random is more than 11 and above, then in that person, you may have to repeat the blood glucose at a different time. So maybe you do a fasting the next time, or you do a glycated. And then when you have two abnormal values, then you can say that this person has diabetes mellitus.
Okay. So in general, that is what diabetes is. Yes. Marilyn, anything to add? Or that's it?
Yeah, I think he has broken it down, and we have types, like you said, we have the type 1, the type 2, and also we have gestational diabetes. So with women who are pregnant, during their period of pregnancy, sometimes their blood sugar increases, and within the period of the 24 weeks to 28 weeks, you could detect when it is done at the hospital. So when they go for antenatal, when it's checked, it can be identified. And sometimes after pregnancy it goes. Other times in the future they develop type 2 diabetes. So it can be gotten during pregnancy too.
Okay. So it's also possible to get diabetes when you're pregnant.
Yes.
Okay. So if you're just tuning in, this is 107.9 Orange FM, and this morning we're talking about diabetes in general. If there's anything, like I said, that you are concerned about when it comes to diabetes, this is the show for you. If you know someone who's a diabetic and is on medication, and you have a question and you think there's something that you want to help them clear up, or you are somebody who cares for a diabetic, this is the show for you. It would help for us to hear your side of the story when it comes to managing diabetes when we open the phone line sometime after 9 o'clock. Our show is brought to you by the kindness courtesy of Marie Stopes. Marie Stopes provides you expert care when it comes to consultations when you have an unplanned pregnancy and about your reproductive health in general. If you're shy, if you're confused, if you have an unplanned pregnancy and you're unsure who to talk to, I think the route is not to engage in unsafe practices such as termination. Your friends are not medical professionals to advise you, but Marie Stopes runs a telemedicine service where you can call and get expert, non-judgmental advice so you can take a good decision on your pregnancies. Their phone consultations are convenient and they get you to access anything that you need to ask the nurse or the doctor in the comfort of your home. If you don't want to talk and you also want to WhatsApp, because we're all WhatsApping now, they also have a line for you to WhatsApp and get your issues cleared up for you. Marie Stopes Clinic will help you take back control of your reproductive health. You can call them on 0800 20 85 85. That's 0800 20 85 85. That's if you want to talk. But if you want to WhatsApp only, it's 0244 208585. 0244 208585. And that's Marie Stopes. So, I mean, Patrick, initially we talked a bit broadly about what diabetes is and what it is not. And, we talked a bit about the symptoms. But for somebody who wants to know, because unlike, let's say, when you have malaria, you have a headache, or you have some fever, you're not feeling too well, if you're poor, you're not eating well, are there very clear signs or symptoms that somebody could be having, and they'll say, no, you know what, I think I need to get myself checked out for diabetes?
Okay. Yes, so there are actually a lot of indications, but then we lower it to 3 of them, that if you see any of these, then you may be thinking of diabetes or possibly getting checked. We call it the 3 Ps. The 3 Ps. The first P is polyuria, like excessive urinating. The person just go to the washroom now and then to pee. When it happens that way, depending on the volume of water you've taken, sometimes with diabetes, you might not even take. Is made up of cells. So the cells are losing because it's high, and the body finds its way to control it or to lower it to a certain level that it will not give some sort of complications. So the person drinks a lot of, eat more. Like Dr. rightly said, the glucose is supposed to be in the cells, where the cells will use it to generate some sort of energy or some fuel for the body to function. It happens that when the glucose is in the blood instead of the cells, it means that the cells go hungry, and it will stimulate your brain, the hunger centers, to inform you to eat more. So the person tends to eat more, because even though the glucose levels are high, surprisingly you will still need more glucose, because the area where the glucose ought to be, unfortunately it didn't get there, because the insulin is not available to move the glucose into the cells. So the insulin is actually serving as a key to open the cells, such that the cells can take up the glucose and utilize it for fuel. So the person will be eating. So these 3 are the cardinal signs of diabetes. So when you find these 3, then it means that you should be thinking of diabetes and possibly getting close to a hospital to get checked, at least to rule out. A lot of things may, come into play for you to pee more, possibly.
Okay, so we have to clarify. So there are people who just love food, because Muda is saying that. So by 6 a.m., I've already had my house akoko. By 9, I'm eating gobe. By 11, I'm already craving lunch. I'm beginning to wonder if I'm diabetic. Doc. So is it just, there are people who just love to eat. Yes. Especially people who are Maryland size, they eat a lot. There are people who just love to eat. Is that the same as, is that the same like what we're talking about?
Not necessarily. So all along, then you can't say that. Then that's a cause for concern. You need to find out why this person all of a sudden is eating at a very faster rate. But then if it's been that person's habit, maybe for some years now, okay, the person has been always eating, and then mind you, the reason why you're eating so much, or the weight gain is virtually normal, then it's unlikely that he has diabetes. One way or the other, once it's not treated, if you have it and it's not treated, you notice other additional symptoms, like the unexplained weight loss, maybe blurred vision, easily get tired, okay, and maybe you'll be eating more frequently.
More frequently than usual.
It's not just about eating so much.
All right. So it's not just about eating so much. It's not just about eating so much. But I like what Patrick said initially. So it's the increased test, increased frequency of urination, and that's increasing more. And then what was the other P? Eating more. So once you have that, start thinking, especially when you realize that you are waking up to urinate at night more than you are used to. There are some people who would probably wake up once, and that is very normal for them. But when you're doing 4, 5 times, 6 times at night, and it's actually disturbing your routine of sleep, then you need to see a doctor. Like, you need to go to a hospital, let me say it that way, because managing diabetes is not just one person's job, it's a whole team effort. So you need to check yourself into a hospital and just tell them that, you know what, I'm waking up to urinate many, many times. And this has been going on for a while. And it's very important, because sometimes that may be the only sign before you get anything else. And diabetes can be very, very silent, extremely silent. You may not see anything, or you may not physically experience anything. It may just hit you like a bus. So it's one of the things that you need to look out for. And I encourage everybody during this time that we're talking about diabetes to just decide. I think 14th is Monday, isn't it? Yes, I think to just decide that on Monday you're going to go to, now you can even check your sugars in
Pharmacies.
yes, like in pharmacies. Yes, you can just walk into a pharmacy and ask them to check your sugar. But it's also important to let them know your last meal, isn't it? Some of us eat very late. Some of us eat really, really, really late, and it may affect the results. So it's important that at least you check. If you also have a positive family history of diabetes, if there's somebody in your family that has diabetes, and that's about 60% to 70% of everybody walking around, it is also important that you screen yourself as quickly or as regularly as possible. Good morning to you, Kojo at Asempa Furniture Works. You're listening to us from Edum. Our show is brought to you also by the kindest courtesy of Prime Diagnostics and Eye Care Services. Prime Diagnostics is located here in Kumasi at Bomson, and they run every laboratory test under the sun, including the ones for diabetes. So if you want to check your risk of diabetes, you can also go to Prime Diagnostics. Their number is 0243 360 282 or 0202561234. They run every laboratory test under the sun. When I say every, I mean every. They do sperm count, liver function test, lipid profiling, they do kidney function tests. They run tests for GCSPD screening, they do cervical cancer and prostate cancer screening. They do Hep B viral load testing as well as paternity testing, and they also do sickle cell genotyping. If I'm going to run through all the labs they do, we will not close. But they are offering a discount in this 2022, a 30% discount. All you need to do is walk in as a club or a group of friends and organization. You just need to be a minimum of 5 members, and they're giving you a 30% discount. So you know what, if you're listening, gather your friends in the office, at church, in your Kifit club, in your WhatsApp group, and say, you know what, we are 200 in this WhatsApp group. On Monday, we're going to check our blood sugar at Prime Diagnostics, and they're going to give you a 30% discount on a lab that's already quite affordable. You can't afford to get sick in these hard times. You can't afford to get sick in these hard times. But earlier, Harris, you mentioned that there are types of diabetes. Can you walk us through that, please?
Okay, so we have type 1 diabetes. We have type 2 diabetes. We can have gestational diabetes. We can even have diabetes in neonatal diabetes. We have diabetes due to other endocrine pathologies. Okay, we can also have drug-induced diabetes. So type 1 diabetes is a situation whereby we have, and we are saying type 1 diabetes is mostly common in the childhood and also the adulthood period.
Okay, so it means that children can get diabetes,
yes,
right?
Children can get diabetes.
Really?
Yeah. So they even say that for those with the risk factors, as early as 4 years, so like 4 to 6, then maybe 10 to 14 years, with the average of 11 to 13 years, they can get the diabetes as early in life. So that's the type 1 diabetes.
That's the type 1 diabetes. So that's the diabetes that you are born with.
Yes.
Okay.
Like there's a predisposition.
Okay, so
already.
there's a predisposition
there's a
for you to get
predisposition
diabetes.
for you to get the diabetes.
Okay.
Yeah.
Okay.
So you can even have maybe your parents, your first degree relatives, being your siblings and also your parents. So there's a likelihood. So if both parents are diabetic, the chance of getting diabetes also increases. It's much higher than if maybe just a single parent has diabetes. Okay. Then we have the type 2 diabetes. So type 2 diabetes is whereby the body is able to produce insulin, but the insulin is virtually ineffective. There's a high level of resistance to the insulin. So it's as if your insulin cannot work. It's not able to work on act on the receptors for the receptors to increase the absorption of glucose into the cells. So when you have a situation whereby, let's say obesity, for instance, obesity is a major cause of insulin resistance, as you know, and then obesity is going up. So that's also type 2 diabetes. It's more common in the adults, like the older populations.
Okay.
So mostly they will say a cut of about 30 years, 30 to 60 years.
30 to 60 years?
Yeah, 30 to 60 years,
Okay.
above 30 years. Majority of patients who tend to have diabetes tend to have the type 2. But then sometimes there's an overlap. So you can have younger people presenting with diabetes, and then when you go on to do the follow-up, you notice that it's not type 1. Okay, so where I said the type 1, we have distraction by autoimmune causes. For those ones, we have the maturity onset of diabetes in the young. That is the MODY. So it's a type of, the onset is in the between them. Then you have to do the antibodies, because the type 1, mostly because of the autoantibodies, then you have the distraction. So when you're able to do the antibody testing, for instance, and it's positive, then it's likely it's type 1, regardless of your age.
Okay.
Yes.
Okay. Yeah. So that's regardless of age. So you can be living, quote unquote, normal life, and diabetes can be picked up later.
Yes.
And it can be determined that it's actually type 1, even though it's later.
Yeah.
Okay. I learn something new every day. It is a free CPD for me every Saturday. If you're just tuning in, this is 107.9 Orange FM, and this is the Orange Health Lounge, and today we're talking diabetes. We are talking diabetes, and if there's any question you have about diabetes, you can send it on WhatsApp on 0548 501 584, and we'll definitely clear it up for you. Now, like when I started the show, I said today we're going to do English. So I don't know what autoimmune is in Chi, but you're all going to try and explain. You're all going to try and explain to our listeners what we have said diabetes is, or the MODY and everything in Chi. If you can say it in Ga, hey, better. If you can say it in Ewe, better.
I'll start. Starchy foods, carbohydrate-containing foods. And I don't be breaking it down to glucose. And our body no I can glucose no. I can say sugar no. I was saying can pediano. If I can so a uses glucose. Now glucose levels no air cost no because the insulin it does a ho and I say a ho intiminya juma and I say any ho cry into no. But when say behwe omogye mu no na glucose level no e was sure and no na say when you see yare.
Okay. Doc has tried. Doc has tried. I need to take a brief commercial break. And when we come back, we'll be talking about some of the very common health myths that people have about diabetes. So pick your favorite diabetes myth and let's bust it here on the show. I'll be back after this brief commercial break.
Regular checkups can help find potential health issues before they become a problem. By getting the correct health services, screenings and treatments, you are taking important steps towards living a longer and healthier life. This is why at Prime Diagnostics in Healthcare, we strive to give you the best of health and diagnostic services. We provide services such as sperm count, liver function test, lipid profile cholesterol levels, kidney function test, G6PD test, cervical cancer screening, fertility profile, gonorrhea, hepatitis B and C screening, genotyping, sickle cell test, syphilis, candidiasis test, pre-marriage test, prostate test, hepatitis B viral load, paternity testing, PCR COVID testing, HIV testing and counseling, diabetes screening, FBS or RBS. Why don't you locate us at Bomso Kumasi at digital address AK316-1041 or call us on 0243 360 282 or 020 256 1234. You can as well visit our website at www.primedecare.com for more information.
Orange 107.9.
And we're back on your radio. This is the Orange Health Lounge, and we're some 46 minutes past 8 o'clock here on Kumasi's Music Leader. The Orange Health Lounge comes your way every Saturday from 8 to 10. If you're just joining us, if you're just tuning up, if this is your first time, welcome. We're here every Saturday from 8 to 10. And here we have healthcare conversations on the things that matter to you most. Our show is brought to you by the kindest courtesy of Prime Diagnostics and Eye Care Services, as well as Marie Stopes International. And my guests, Marilyn, Dr. Harris, and Patrick, are here talking diabetes. I mean, there are so many things that people think causes diabetes or brings on diabetes. And what are some of the popular ones that you have heard? Because when you sit in clinic and you give somebody a diagnosis of diabetes, usually one of the first thing they say is, or they say they don't eat that much sugar. Is there anything that relates eating so much sugar or sugary foods to diabetes?
So it's not only about, it's more of the glucose, as we said. So the carbohydrate, the rice, the cassava, the starchy foods. And we Africans, we really enjoy eating good fufu and all those things. And the time we eat it is also a problem, because if you don't sleep early and you're eating, when you don't sleep early, you tend to be hungry more. So when you tend to be hungry more, most of the time your brain craves for more of the glucose.
Okay.
And if your brain craves for more of the glucose, you tend to eat these starchy foods at night more. So it's about the breaking down of that glucose. So it's not only the sugar, because for women, at least you should take research has shown that you should take 6 teaspoons of sugar in a day. Okay. Then for men, the maximum is 9 teaspoons of sugar in a day. So if you tend to eat more of these starchy foods and it's not being able to break down. As we said, we have different types of diabetes. So if it's not able to break down, it stays in the blood stream. So the blood vessel, when it stays over there and you're not getting, the insulin is not acting on it to get into the cell, which is the body tissues, the body organs, then your sugar level goes high. So it's not only about the eating of sugar. It doesn't really relate to sugar eating alone, but it's more of the starchy foods.
The starchy foods.
Yes, please.
Okay. But our diet is 85% starchy food. It's predominantly starch. So
we advise more of the Mediterranean food in terms of eating more fruits, vegetables, and if you are eating your fufu, quantity of your fufu, the soup should be more, and the protein, healthy protein should be more than the fufu itself. Because if you're not using that energy, it tends to store up. So if it tends to store up, then especially if you are, having the type 1 or type 2, then it's either the body is fighting against itself, which is the type 1, so it's not breaking down. The pancreas is not acting as it's supposed to secrete the insulin. Or you are eating it all right, but like you said, you are too far. You are gaining more weight. So when you're gaining more weight, you should be watching out, because most of the time the insulin is not able to act on the food that you are eating. So your blood level, your blood sugar increases.
Goes up.
Yes.
So, Patrick, our diet is not good enough. We can't escape it. And I got a message from someone who says that usually when people say pot bellies, we think about men, but he has noticed that a lot more women have pot bellies nowadays. He says that they are better at covering it up. The way Marilyn is laughing, I know you agree with him. I know that you agree with him. You know, our diet is predominantly starch-based. I mean, if you look across the country, our diet is starch-based, and fruits and vegetables are not are not part of our routine. I haven't seen anybody eat an ayo of fufu and say, "Oh, let me add some pineapple to it." It hasn't happened yet. It hasn't happened yet. For someone who is listening who is probably predisposed to diabetes, how should they manage their diet? Like, is there something? Because, you know, the only thing that comes to mind when it comes to a diet that is probably a bit lower in starch or carbohydrates that I think people really enjoy all over is probably gobe. Probably. I haven't done the calculation, so if you've done it, send it to me. Probably.
Yeah.
But for people who are eating out, which is a lot of people, what should they be doing? Like, how should they be buying their food, managing their food? Because Charlie, you can't go and stand by the watcher woman and say, "Madam, you know I'm on diet, so give me watch it 2 cedi and meat 5 cedi." Everybody will look at you like, "Hey, is everything all right?" What should we be doing?
Yes. Okay. So I'll just add a few to what Marilyn said concerning the sugar eating stuff. You know, the discussion, we're saying that when the pancreas, the organ that produces insulin to actually aid the cells to take up the glucose to work with it, if it has a problem, if there's a disease, to the pancreas, or if there's trauma to the pancreas, and or anything that happens such that the pancreas is not able to produce insulin, means that there will be excess of glucose in the blood.
Yeah.
Now, when you eat extra glucose, that means if you have been diagnosed of having diabetes, and then you are taking more of the sugars, then it will complicate this issue.
Okay.
It's not necessarily taking more of the sugars that will, have issues with that, but the organ
itself.
the organ that is supposed to do the job if something happens to it. So that's the distinction with that. With our eating habit, in fact, we can't deny the fact that most of our homemade food is just carbohydrate. But the issue here is that lack of exercise is actually the the predominant predisposing risk factor to developing diabetes around. You eat anyway, but how active are you? A lot of people tend to be like, "Oh, me, when I eat, I'll just sit small, because the doctors are saying that you don't need to eat and sleep immediately. So I'll eat and then sit and watch some movie and then sleep over for some time and get back to my bed." So exercise is a good thing for us to do. We advise that we should limit the intake of more of the carbohydrate foods. So you can, if you are eating, sometimes I heard something like, "Oh, yes, mindi fufu half, midi 2, yes, mindi 1, into a carb mama
no.
That is not the case. Yes, fruit and vegetables.
Oh, but there's vegetable in the soup.
No, vegetable in the soup. Which of our soup will virtually contain vegetables?
But I see vegetables
in the soup. If you go out there to
soup.
buy food, hardly would you find vegetables.
Would you find vegetables in it?
Okay. So
No,
that's
but
the
go
recommendation.
on. That's the recommendation.
So some people are like, okay, I'm told that our lifestyle in terms of eating could predispose us to developing diabetes. So I will not eat at all. Yes. I don't want to put on weight, so I will not eat at all. That's also bad. You can't just deny the fact that you don't want to put on weight, so I will not eat at all. No, the recommendation is that you should eat, but the quantity.
Okay, so if I'm listening at home now, every day just eat plantain. You understand? So when we talk about quantities, how will I
extra glucose that is not being utilized will be stored as the quantity.
So it means that you have to really be active.
You have to be active. It's not just, you can eat right now and sit in your TV. Instead of doctor said I shouldn't sleep 2 hours after eating. Once you are sitting, it's more or less like you are sleeping because you are not active.
You're not active. You're not doing
so
anything.
So you really need to be active. You understand? Maybe you take a stroll, maybe you do something, maybe you pack your books, you do that. You are active. That one you utilize the glucose. But once you sit to watch television, yes, you use a bit of it, but the remaining will be stored because there's nothing you can do to it than to save it for you, maybe possibly for future use, which of course you will not actually use it.
Is that why the nurses and doctors eat kenke in the morning?
No. We are always on the run, so we are active. So you need to eat something heavy to sustain you. You understand? But at the end, you don't see most of the doctors and the nurses having pot bellies because we are so active all the time.
This one there, it is home defense.
But then we have dietitian consult. We have people who have studied our eating pattern, what is healthy for us to eat. So we make a recommendation that you could visit the hospital and then request to see a dietitian, and the person will guide you to developing a meal plan which will be safe for you and your family. So that's what we recommend. So we have experts in that field as well who guide us to eat healthy food.
This is 107.9 Orange FM. It's 9 o'clock and we're talking about diabetes. What is it about diabetes that you want to understand? What is it about diabetes that you want us to talk about that we haven't spoken about yet? Yes, we mentioned gestational diabetes, and we'll be talking about that in a bit for you to understand. As someone is asking me that we mentioned what gestational diabetes is, but we haven't mentioned it. Earlier, we talked about age. Are there any age limits to diabetes?
No, there are no age limits to diabetes.
There are no age limits. No. You can get diabetes from early till when you are really old.
Yes.
Okay. I'm asking this essentially because someone wants to know that his grandmother is around 80 and she has recently been diagnosed with diabetes. She refuses to take the medication because she says that she's already 80. And he's actually not sure that an 80-year-old can get diabetes because, she's cool. You understand? But there are no age limits.
There are no age limits.
Okay.
So I think I wanted to add something to all that we've been saying so far. When it comes to diabetes, I think the most important thing we need to bear in mind is about the risk factors. Okay, because we all eat, we all exercise, we all take medications, but we all don't get diabetes. So they are about the risk factors. And then the predisposition is one. So you realize that when as you're talking about diabetes, the majority of the patients with diabetes are type 2. And we said that type 2 is basically due to the fact that they have some amount of insulin, but then there is resistance to the insulin. And that this resistance is basically due to maybe having what they call metabolic syndrome. Like you have high levels of cholesterol, they have hypertension, they are obese. Okay. So these things, most of the people that we are talking about realize that they may be eating well, but then when you go to their workplaces, they are virtually sitting the whole time. These drivers sitting the whole time, okay? And for some people to even smoking, alcohol intake, okay? All these things are risk factors for cardiovascular disease. And once you have these cardiovascular diseases, you are also at risk of developing diabetes. So even with this 80-year-old woman, for instance, if you are to check, it could even be that she's even a known hypertensive all these years. Okay, it could even be that her lipids or her cholesterol levels hadn't been checked all these years. So type 2 diabetes is like a metabolic syndrome. You can have hypertension, you can have high levels of cholesterol. You may be that you are virtually obese or overweight, or maybe you have a sedentary lifestyle. All these things will predispose you to getting your diabetes. So although you might be eating very well or even exercising very well, but then maybe the person might be smoking or the person might be taking in alcohol, unusual, as in excessive amount of alcohol. Okay, and then the person may even have a genetic risk factor, which is more common in type 2 diabetics. So the underpinning thing is that we are all not the same. We are all not the same, and then people can even get diabetes from the medications. Okay, Somebody I know someone who went in for I think steroid therapy. Okay, one person was suffering from I think some spondylosis, severe one, and then he had to do intrathecal injection of steroids, and the person ended up getting diabetes as a complication of the steroids. So yes.
So you can't get diabetes from
other
causes, like
causes.
from other medical management or something else.
Yes, and it's all because these steroids, for instance, they oppose the effect of insulin. There are other counter-regulatory hormones like cortisol. You can have your epinephrine, your catecholamines. You can have your growth hormone, your glucagon. All these things can counter the effects of insulin. Insulin is supposed to reduce your blood glucose levels. But then when you have anything else that is opposing the effects of insulin, then you may end up having diabetes. You may end up having...
It could as well be...
iatrogenic, something that maybe drug, or you went for a procedure, they had to give you a particular drug. Or you can even develop other metabolic conditions. Let's say Cushing's disease, for instance. You have acromegaly. Some people, they are virtually becoming bigger. They have what do you call gigantism in the childhood period. You see someone, he has very big hands, big jaws, okay, excessively, as in he has a lot of growth hormones. So this person is also at risk of developing diabetes. Okay, somebody can have a pancreatic tumor. Okay, he might even have a trauma and an injury to the pancreas. He can even have chronic pancreatitis, and they will end up having diabetes. Just that they wouldn't fall under the typical type 1, type 2. But they would have diabetes. People on steroids, okay, like glucocorticoids, even people taking antihypertensives, for instance, can also develop diabetes because of the side effects of some of the medication. They all go to influence or inhibit the effect of insulin. Okay, so anything that inhibits insulin would rather lead to high levels of glucose in the blood, and that is diabetes.
Interesting. Yeah. So it's not really just about your predisposition.
Yes.
It could also be a diagnosis. People are in denial, and usually I don't blame them, because we do not seem to break down the reasons for them well enough for them to understand that, okay, it is possible that I may be diabetic. This is 107.9 Orange FM, and this morning we're discussing diabetes in all aspects. And I haven't forgotten your question, my dear. Okay, so she was asking that we said gestational diabetes, and that if we could explain what, Marilyn, what gestational diabetes is, because she has heard it before, but she's unsure what it is.
So when it comes to gestational diabetes, sometimes the placenta can inhibit the production of the insulin. So when it does that, the glucose, the insulin is not able to break down the glucose. So if it's not able to break down, definitely there would be increase in glucose level in the blood. So most of the time it has to do with the placenta. So it depends on what the mother is also eating, because sometimes some tend to eat a lot, and some other times too it stays, like the person becomes a diabetic. So all these could predispose people, and sometimes the weight you didn't have. So all these things could be risk factors, and it doesn't mean that I shouldn't be taking care of myself. So these are things that you have to check. As we said, cholesterol, all those things could lead to that. So that's what.
So I want to add something. So it's not every pregnant woman who gets diabetes. Okay. So you can already have patients with parental hormones, and then you have progesterone coming in, prolactin coming in, estrogen, cortisol. All these counter-regulatory hormones tend to downplay the effect of insulin. It's like that you're going to have high levels of glucose in the mother's blood, and that glucose is one way or the other transported to that of the baby, because the baby doesn't produce some of these things. So there should be high levels of glucose in the mother's blood, so that at least these ones can go through the placenta to the baby, and then the baby can get the glucose for energy and other things too. But then about 2% of women, they are unable to weather the storm. It's like that, although they are going to have these counter-regulatory effects, the body is able to make sure that the amount of insulin there is still able to work, and then you're not going to have that persistent hyperglycemia.
So it's not really about the diet of the mother when she's pregnant.
It could also
It could be.
It could be.
Okay.
Because it's all about the predisposition. So the risk factor for even gestational diabetes is, assuming maybe her first pregnancy, she had gestational diabetes. It's another risk for her getting diabetes in pregnancy in the next time. These things are risk factors. Family history of diabetes even predispose the woman to getting gestational diabetes when she's pregnant. So it's just about 2% of the women who still have these counter-regulatory hormones effect superseding that of insulin, and that they have the persistent hyperglycemia. And then, like she's saying, because it's all because of the placenta and then the hormones in pregnancy, for most people, once they deliver, okay, within about the 6 weeks or so, everything goes down. The hormonal levels, everything goes down, and then they don't have the persistent hyperglycemia. But others also go ahead to develop diabetes, or the persistent hyperglycemia continues even after the puerperium. Okay.
So then it's important that when you're pregnant, you also check your sugars, right?
Yes. That's why, at least at antenatal, they will do the initial screening, and then from 24 to 28 weeks, that's where they're virtually looking for the risk factors or the probability that a person can develop diabetes. Most often, they check your urine. So your urine glycosuria is common in pregnancy because of the increased threshold, the renal threshold, the absorption increases. So every person can develop, you can have some amount of glycosuria, amount of glucose in your urine, but then if it is so significant, then it means that they have to go ahead and do the screening. So sometimes, though we are saying there are some cutoffs to the blood glucose, for some it's the night before, and then they give them that glucose. But before that, they would have checked the fasting blood sugar. So if they check and it's more than 7, then that means that this person, for instance, may even have the diabetes. And they would even go ahead to do the load. But for those who may be having the random blood glucose between 5.5 and maybe 6.9, those are those maybe either they have to go ahead and find out if they really have diabetes by giving them that glucose challenge.
The glucose challenge.
So they will do the fasting blood glucose. They will do a 1 hour postprandial. Others even go ahead to do 2 hours and even 3 hours. And based on the values that they are getting, there's always like a cutoff depending on which ranges you are using. That will let them know that, okay, this person indeed has gestational diabetes, or somebody just has impaired glucose or fasting tolerance.
Okay, you're listening to 107.9 Orange FM, and this morning we're talking about diabetes. If there's any question that you have about diabetes, this is the time to ask it. In a few minutes, I will be opening the phone lines for you to ask your questions. It's important that we also hear from you. If you've got a concern, you can send it through, and I'll definitely get it answered for you. But if you want to text it or send it as a voice note, you can do that on 0548 501 584, 0548 501 584, and I'll definitely answer it for you. So there's an interesting conversation on a platform that I'm on, and someone is asking about the essence of brown sugar when it comes to diabetes management, that he has heard that brown sugar is one of the very good things when it comes to, diabetes management or diabetes care. And he wants to know whether there's any the truth. Is there any truth in that? Does brown sugar play any role in, managing diabetes? Because it's very common on the markets now.
I think the brown sugar is just the sugar and the honey. I'm sure that's a combination.
Yeah.
And with the honey, it's a natural sweetener. Meaning that the attempts to add more will reduce because the honey itself is already giving you some kind of sweetness. So you would reduce the quantity you are going to take. To me, that's all I can say, but that doesn't really mean that it's going to manage the diabetes for you. There are a lot of things that you could do to manage your diabetes not necessarily the brown sugar.
Okay.
Yeah.
So it's not really about the brown sugar
No.
doing any magic.
No, it will only reduce the quantity of sugar you take because the honey gives you some kind of sweetness.
Okay. It looks like, but it's very common, isn't it?
Yeah, it's common, I don't know. But a lot of people are on it, I actually hear some of them. The market may also try to even convince some of us to purchase that.
To buy that.
They think it's good and stuff. But
No, I think it's also because people have, or there's a widely held perception that sugar is bad for you. So sugar substitutes, alternative sweeteners like honey and what have I seen recently? Cinnamon sticks are all sort of in the mix.
yeah, so I think our recommendation would be on the natural sweetness, like the honey. So when you take that one, I think we see that to be a bit helpful because it's natural. When I say natural, I mean
You mean natural?
It's in quotes. Some people also abuse the fact that the thing is natural. Too much of everything is bad.
It's bad.
So we should try and be in moderation. Do it in moderation. Yes.
I see. So many.
When you take it more, if you already have a higher levels of potassium and you're taking banana where you think it is natural, it can also increase the levels of the potassium. You understand? It has other sugars as well, which can equally increase your sugar levels. So natural doesn't mean you can just take it like in excess. No, you should be conscious of the quantity you are taking.
I mean, it's
because people have the notion that diabetes can be cured. It cannot be cured
it can't be cured.
at all. You can only manage it such that you won't have complications like stroke. So people giving alternatives. I think it has to do with the trust they have in our health personnel. Because I don't know why you come to the hospital, somebody managed to diagnose you, then go to an alternative to manage your sugar levels, the disease condition itself. So it can be cured. That's just what we have to say.
It can't be cured.
It's the hard truth. It can be cured. Just that we can manage it such that you won't have any complications. I've heard questions, a lot of people asking me that, so I'm going to be on the drug for a very long time.
Life.
And I check my, some don't even check their glucose levels. So once you're on the medication, the doctor will request that, maybe in a month or two, come back to the hospital, then we'll do assessment again to see. Because the person is fine on the medication or has been fine throughout the period, will not honor the review date because he or she feels fine and then think that with that period that has been given, the medication, if for nothing at all, might have cured the condition. That's why they come in with strokes and other medical conditions. It's just, the hard truth.
I want to add to what Patrick is saying. When it comes to the diet, fortunately we have people who are, specialists in, our diets, like dietitians. So I would say that we should, take advantage of the dietitians one. And when you're diabetic doesn't mean, say, uchnibi, and you're there are lots of things you could eat, just that you have to eat them, the quantity you have to reduce. So it's not like, like you're saying, just stay to the medication regimen. If you are fortunate to do a transplant, that's good. Yes, but you still have to be monitoring your sugars thereafter. And diabetes is different for everyone. The same treatment that will be given to me won't be the same treatment for you. Because we are all different. And it happens to people differently. So whilst you're taking your medications, when you're getting better and your sugars are regulated, the doctor or the prescriber steps down your dosage. It's the same with hypertension. So those two conditions, it's manageable. And the most important thing is to prevent complications, because it's the complication that kills faster than even the disease itself.
Okay.
Yeah, so if it's not well managed, ask question, the person would take time and explain. But if you don't, yeah.
It's important that you ask questions, is it not?
Yeah.
Like about your medication, about the complications. But Marion started talking about some of the complications. So we know diabetes is not curable, but you can manage it. But I think that if you manage your diet very well, you stand a better.
Know the source or the cause or the type of diabetes that the person has. Because I have patients that when you tell them, "Ma, me where you know when you're such a area or some you used to do lasted." Okay, it's something that you cannot cure per se in our setting, and that you can do something about it to prevent the complications. So when you do that counseling and the person accepts it, that doesn't mean all manner of things. You just threaten him or scare him. But the man wouldn't budge. So they told him when he was like, "Okay, some man actually didn't support him." And it's like, "Oh, you be child nine, so is that future?" And then they told him that, "Oh, na you be." I was in the zoo. At least for a typical Ghanaian, for him, a man will be having the microalbuminemia. They will be urinating, and if you have to do a test, you realize they have proteins or albumin in the urine. That unless they come to the hospital, they wouldn't notice. Okay. The only thing that might bring them to the hospital would be menacia tartai, like the peripheral edema. By that time, it would have been an end stage sort of thing. Okay. And then the last one with the microvascular is the neuropathies, the nerves. Okay. Sometimes even the vessels that supply the nerves are affected because of maybe atherosclerosis. He has hypertension. He has high levels of lipids. So the person may have nerve problems.
Okay.
Example, the person may present with a tingling sensation or the numbness or pains. That one is very typical. They come in and they are saying, "Dr. Menayan, I say, like I am a year to me." Sometimes they feel now like they are walking, they are not able to feel anything. You don't really notice before they realize their leg is bleeding or they have an ulcer or a wound on their foot, all because of the nerve problems. And it's all because of the high levels of glucose. Okay. So when it comes to preventing these complications or managing these complications, the first thing is manage your glucose. Make sure it's well controlled. If it's well controlled, then some of these risk factors or some of these complications will lessen or be delayed. Okay. And the macrovascular ones, that's in the bigger vessels, when you're affected, you can have stroke, cerebrovascular accident. You can even have an MI, an ischemic heart disease, or maybe the nerves. If the vessels are affected, that's when you're having a peripheral arterial disease. And that's together with maybe the neuropathies can lead to amputation when they have an ulcer or they have a wound which doesn't really heal. So those are the complications with the diabetes. And then they have the autonomic neuropathy. It's all part of the neuropathy. That's when we have the erectile dysfunction for the men. You can even have fecal or urinary incontinence or bladder dysfunction or even orthostatic hypotension. Like they feel dizzy when they stand from a sitting position. And then some of them too, when they come to the hospital, you check their pulse, you realize that though they are not febrile, they are not maybe anxious or anything, you check their pulse rate and it's virtually high. So others too can have the gastroparesis, they're having diarrhea or vomiting. Okay, most of the time they will tell you because they have problem with gastric emptying. So the size of the medication alone. That's one thing. Even among health workers, sometimes even checking their glucose level is not easy. That break alone, and much more to think of the fact that he has to be on insulin for the rest of his life. Some of them try it, and then as the glucose levels go down, if they don't really understand the disease condition, and it's like, "Oh, I don't know, you maintain here," you say, they stop, and then they have rebound hyperglycemias. So I think with the management of diabetes, it's all about one, acceptance of the disease. It's about the counseling. Okay, letting the person know that it's with you for this number of years, and then it's manageable. Okay, so when I sit in the consulting room, they come, let's say a young person, 35 years, he comes and he's asking me, "Doc, then I ask him, have you seen these old people?" Some of them are 85, others 90, and they are still coming to the hospital. So if there was something that was curing the diabetes, do you think they will come? And then they are able to reason with you and like, it's true. And I even tell them, some of them, they were here, they went to seek unorthodox.
Yes. Versus like everybody is selling something that must cure diabetes, like it will cure diabetes. So most people feel like, okay, I have heard this medication somewhere and it's going to cure my diabetes. And I mean, when I used to work in Confanoche, I'm going to share a story with you guys. There's a very popular woman in Kumasi who used to sell a concoction around the zoo area. So those who know, like from those days would know, around the zoo area, like very popular. People would go to her for diabetes medication. But she was my patient at diabetes clinic. She was my patient at diabetes clinic, and I didn't know.
Oh, okay.
So one of her clients also came to diabetes clinic and met her there and said, "Oh, now what are you doing here?" Also, Miss Modo But she was really, really popular.
Yes.
And she had adverts on radio and everything. And I remember talking to her that, you know what? So essentially all she was doing was looking at her.
Yeah.
You understand? So the point is that which you must, because there are diabetics that I know who have used strict diet plans to reduce their pill burden. So at first they were taking 2 or 3 types of pills, and now they're probably just on 1, and they're okay on that. You understand? So there are ways to manage what is going on and reduce your pill burden. But not any one silver bullet to just pop off. Because I know when somebody is in their 30s and gets diabetes, Charlie, can even taking 1 multivitamin a day is a problem. How much more swallowing this metformin, which is quite big.
Yeah, it's quite big.
And you're doing 2 in the morning, 2 in the afternoon. No. I mean, it's not going to work. Anyway, let me open the phone lines now. If you've got a question about diabetes, this is the time for you to call. 0541. My name is Dr. Jima, and today we're talking diabetes. Let me give a shout out to our folks at the GUSA Games on KNUST campus. If you haven't been to KNUST campus, you have to go there. I'm going there right after here. We have some serious athletes in Ghana, and they are all university students, and I fear that they will stop whatever they are doing once they finish school. All right, let me pick this phone call. Hello, good morning. Producer, I have to sort this thing out. Hello, good morning. Hello, good morning. Hello.
Good morning.
Yes, good morning.
This is from Toronto.
Okay, kindly go ahead.
Yeah, I want to ask. I want to ask that if I eat and I sit down and I'm using like that, am I using some of the glucose or the calories, or it starts up to this implication? I want to ask.
Can you kindly repeat your question? It was not so clear, please.
I was saying that I use kente.
Okay, you weave kente. Okay.
Yes, we sit there and we read. So, but we normally take our body, our legs. Yeah. So I want to ask if when I eat, I use up all the calories, or some stores up to lead to diabetes.
Okay. Yes, I mean, good question. Thank you very much for your call. Good question. He weaves kente, and he's saying that so when he eats, he comes to sit behind his loom and he's weaving his kente. So now he's wondering, from all that we've said, that is he using up all the calories that he gets from the food, or is what is left over converted to fat? Good question. Because his job is such that he sits down. He can't stand and do it.
Yeah. So when it comes to even the exercise management of diabetes, unless it's not a diabetic, but if it's a diabetic, for instance, we encourage that at least they do at least 30 minutes a day of moderate aerobic exercises, maybe brisk walking, skipping, or even just walking alone can help.
But for him, if he's not a diabetic,
if he's not a diabetic, fine. So what that we are saying is about predisposition and then risk factors. Okay, that is his style, that is his work, and then that is the nature of his work. It's just like a doctor sitting in a consulting room or a driver, a long distance driver. Okay, so that risk is there, but in as much as the person's work, that will not allow him to do that much of an aerobic exercise or walking or anything. At least if the person is maybe walking to work, that alone is a form of exercise. You shouldn't just downplay the fact that, okay, you are doing something that will let you sweat, because it's about the muscle activity. Okay, muscle contraction. Once you are using your muscles in anything, like even say sitting down and then doing all those sort of things, the muscle tends to also use up the glucose in the blood. So, and that one is actually independent of the insulin levels. Okay, so that is why we encourage people to be much more active. So once it's active at work, it helps. All that we are trying to speak against is maybe someone sitting behind just a computer, okay, or someone just in the office, virtually sitting the whole time. But at least once in a while, if this person is able to stand and walk, okay, or maybe in the evening, he walks to a house, or he does something, anything that will let him sweat at least for that particular day. Or if not necessarily that day, they will say that at least for about 5 times in a week, you should do about 15 minutes of any form of exercise. That would help burn down the calories.
But then, Shamarlin.
Yeah, I want to buttress on what he is saying, especially with our old women and also, I mean, people who are maybe like the tailor, like what he's also doing. Because if you don't exercise, like he's saying, you don't burn the calories or you don't burn the glucose you're eating, so the fuel. Yes, you're getting the energy, you're sitting, but even for the old women, there is a therapy for bench to bench. So if you're sitting in your house for long hours, you just have to walk to another bench and you make sure that the next 10 minutes, the speed of that walking is a little bit faster than the other. So you try and walk at least within that 10 minutes, then you sit, you relax, especially for people who can't, because of sickness and those things, they can't do massive exercise. So you do from bench to bench. It's called from bench to bench. So that 10 minutes brisk walking, or you do it slowly for 2 minutes, then you sit down. Then the next day you increase the tempo for doing it. So someone who is doing that, like he said, at least in your daily life, 30 minutes of exercise or walking briskly to your workplace or whatever, it's good enough.
Yeah, but then for him, Yusuf, it's also about the kind of diets you are eating.
Yeah, that's true.
Because if you are sitting, and I know the kind of work that you guys do, that you sit for long hours, you should plan your meals. I mean, if you eat very heavy in the morning, like some huge bowl of fufu, definitely you cannot burn all those calories within even the 6 hours or 8 hours that are sitting down to weave your kente. So you need to have a good system of eating. I mean, you eat healthy. Let me put it that way. Sometimes we feel that also did I don't know who put that into our heads anyway. Like, we eat very heavy in the morning. Pardon?
You need to fill the tank.
But I mean, if you eat very heavy in the morning, I'm going to get very lazy.
That's true.
You understand?
Yeah.
So, I mean, I think it's more about your calories and your metabolism and your calorie deficit.
That's true.
More or less. If you're putting in so much and you're taking out so little, definitely the excess has to go somewhere else. So you need to balance it out. Anyway, 0541-022318, 0541-022318. If you've got a question to ask about diabetes, this is the time to ask that question. I know I have a lot of friends who always go and buy some wache in the morning around the post office area, because the excuse is that, I won't get time to go and eat lunch. So people eat really heavy breakfast. And I remember I was very surprised when I somewhere around KJT, around 4 a.m., like they were already pounding fufu. So around 4 a.m., like it was already on, like king. And they were saying that, it's for the drivers. I'm like, hey, the driver is going to eat this before setting off there. I mean, he's going to get really, really, really lazy. So 0541-022318 is a number to call if you've got a question. Our show is brought to you by the kindness courtesy of Marie Stopes. Marie Stopes is now offering a telemedicine service. If you're confused, if you've had an unplanned pregnancy, yes, we know it happens. Pills and medications can fail, or you can just be lost in the moment and you can have an unplanned pregnancy. The most important thing is that your friends have not gone to medical school yet, and even if they have, giving you advice over the phone without assessing you properly may not be the best option available. Marie Stopes Ghana offers expert staff who do this for a living and give you options that can help you make a best choice for your future. Now, for their telemedicine service, you can call them or send them or communicate to them via WhatsApp if you don't want anybody to hear your voice. And they give you very unbiased and non-judgmental medical consultation over the phone, so you can make an informed decision about your pregnancy. Now, save this number on your phone. Yes, you know you're listening to me, you know yourself. Save this number on your phone. Your bestie is not a doctor, neither is she a nurse. And trust me, sometimes the options that they will give you can land you back in hospital. 0800 20 85 85. That's the call line if you want to call Marie Stopes and talk to them about your unplanned pregnancy. 0800 20 85 85. Or if you want to WhatsApp, 0244 20 85 85. And they will be there to reach out to you. It's very safe, very, very, very safe. You can get the best advice for yourself through this platform. Our show is also brought to you by the kindest courtesy of Prime Diagnostics and Eye Care Services. Prime Diagnostics and Eye Care Services are located here in Kumasi at Bombs. And we've been talking diabetes. Yes, they run one of the best services in terms of laboratory here in Kumasi. They can actually come to your home or office and take your sample, run it, and send you the results or send the results to your attending physician. You can call them on 0243 360 282 or 0202561234, and they are always there for you. So you can call us if you've got a question about diabetes. 0541 022 318 0541 022 318. Doc, so there's a commentary about what people popularly refer to as keto dieting, and if it has any impact on diabetes. And I know this person asking, he has lost some significant amount of weight, because I knew he was at risk of diabetes, and he was like, he went on keto dieting, he has lost significant weight, and he's asking, is he still at risk of diabetes?
So he has to find out his risk factors. If there's a family history of diabetes, one, and then let's say, is he a known hypertensive? Okay, is he having high levels of cholesterol? Okay. So
let me pick this coin, and we'll have to answer his question. Where is my producer, Kobe Drill? Okay, the line has dropped. 0541 022 is the number to call. Sorry, kindly call me back. 0541 022 Yes, kindly.
Yeah, so it's a multi-factor situation.
Mm-hmm.
So it's not just about the diet. It's not just about the exercise levels, but then other risk factors. So even the age, for instance, okay, the family history. These are things you cannot change. Okay, and maybe the person is working on the diet, so maybe the fact that he's lost weight and other things may not necessarily put the person in the category of obesity. But even that one, the person may have to know his BMI. Yeah, so you have to know your BMI, regardless of how much weight you would have lost. You need to know your BMI. Because when you say obesity, you are using a particular BMI. At least more than 25 is like an overweight, and then more than 30 is like obesity. And then the other factors, so hypertension, is the person hypertensive? Is the person having high levels of cholesterol or dyslipidemia? Okay, does the person smoke? Does the person drink alcohol? All these things are risk factors for you developing diabetes. So not necessarily that we are doing a keto diet, so we are out of the blues. No, you just have to make sure that at least your exercise level as well. You are not living a sedentary lifestyle. Because when you do all these things, the sedentary lifestyle, your hypertension, your dyslipidemia, they will lead to insulin resistance. Mind you, diabetes is about the insulin. Either the lack of it or the reduced level of the insulin or the fact that the insulin is there, but then it's ineffective because there are resistance to it. So the person has to check all these things. And even looking at the age, sometimes the age predisposes you because you may have some atherosclerosis, cardiovascular disease or something. So not just the keto diet, but you have to look at other factors as well.
But I know people try all sorts of, I mean, like we said earlier, people try all sorts of things. And like this listener was just sending me his labs. And, you know, when you go to the hospital, the nurse who sees you, the doctor who sees you, the dietitian, the physiotherapist, all those people, they are there to make sure that you are better. Nobody is trying to rip you off. If they were really trained well, nobody's trying to rip you off. So, I mean, he has sent me a list of all the labs that he was asked to do to try and ascertain his risk factor for diabetes. And he said after all this, they said I'm not at risk. Yes, it's good that they did that. And you know you are not at risk. You know, sometimes the perception is that you know, but all those things are done so that the person attending to you knows that you are not at risk. Because you can go to a hospital and say, oh, mensa IATTT, mena IATTT, and they may do the random blood sugar and it's normal. So, you know, they are looking for why you are having that numbness. And they may ask you to run some labs. Please, please, please. It is not a ploy to waste your money. It's not a ploy to waste your money. It is important that these things are done. And when it's done, it's good that you've kept them, because the next time you go to hospital, it's always good to show that, and that it's not repeated, or it acts as a reference point for the person who is seeing you to know where you started from. Please, 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 it's important. 0541 022 318 0541 022 318.
Yeah, so I was just trying to say that for this particular person, though at that time they said the person is not at risk, is not at risk at that time.
At that time,
the risk can change any moment.
That's true.
Okay.
It's true.
So it's not like forever I've been declared fit and then that is then, you know.
Hello, good morning. Hello.
Good morning.
Yes, good morning. If you could reposition, I can't hear you clearly. Hello.
Hello.
Yes.
I want to ask whether these are myths or they are true. I once said someone, I don't know whether it's a medical practitioner or someone, he said when you have diabetes, or to know you have diabetes, you have to taste your sweat. When it is some sugary or something like that, then you know you have. And some people also say when you take in alcohol, not much, you burn some of the fat in your abdomen. So I want to ask whether they are myths or they are true, or something to go by.
Okay. Thank you very much for your call. I really appreciate it. 0541 022 318. My panel.
Well, these are good questions.
Very good questions.
Answering you.
I like the last one, because that one I've heard it before.
The alcohol,
Yes,
burning fat, and
yes.
stuff. Well, the sure diagnostic thing to do is not tasting your sweat.
Okay.
You have to get your blood checked.
Okay.
So, well, your sweat may test sugary anyway, but you have to come to the hospital and we do thorough checking for you when.
Okay. Hold on. Let me pick this call. Hello. Good morning.
Yeah. Good morning, sir.
Good morning. Your name and where you're calling from, please.
My name is Benjamin. I'm calling from Bo.
Okay. Kindly go ahead, Ben.
Please, I would like to ask, sir, if I'm having the diabetes, so how experience that can you see that I'm having it? Like, if I'm having it, I don't know that I have this type of sickness anymore. I get to me.
Could you please repeat your question? It's not so clear, please.
Yes, I'm saying that. Like, if I'm having that sickness, how do I feel? It tastes like how? Or how do I know that I have this type of Foundation.
Okay.
The next question is that if I have a taste waist pain and I come back up my head, I went to hospital. They did a blood test, but they didn't tell me anything.
Okay. Did you ask them what the blood test was for and what your results were?
They told me that is nothing. I don't understand. It's still paining me.
Okay. All right. We'll answer your questions for you. Thank you very much for your call. Okay. Before we go on, let me say this. When you go to a hospital, you are the client, you are the customer, you are the person for whom we are seated there. So please, anything that's done for you, ask. Let me pick this call and then... Hello, good morning.
Hello?
Yes, good morning.
Good morning.
Yes, your name and where you're calling from, please.
I'm calling from Ataki.
Okay, go ahead.
Yeah, please. I would like to ask you, can sugar level cause Kiliot?
Can sugar levels cause?
Kiliot scar.
Keloid scar.
Yeah.
Okay.
Because I've been operated on, that was 2020. And now I had a Kiliot. So I sent it back to the hospital where I had a surgery. But because it has grown big, so the doctor wanted to do a surgery on me. So somebody told me that maybe it could be that my cholesterol is too high. That's why the sugar level is too high. That's why I'm having a Kiliot.
Okay. The
So I
panel
wanted
is
to have
here.
this opportunity to ask if there is something I can do about it, because it's growing.
Okay. All right.
So they gave me two options: whether I can get pregnant so that they can do CS and then they cut it off, or I should come so that they can cut it off. But I'm scared. I don't know what to do.
Understandably so. All right. So we'll answer your questions for you, my dear. Thank you very much for your call. All right. So let's finish the alcohol bit about the alcohol melting the sugar.
But alcohol doesn't burn down your fat. It actually increases your fat levels.
Okay.
Sports breakfast, we deal with the youth the more. And we've realized that every weekend you see a whole lot of young men and women on the street trying to burn some fat. They start on the field. That's what the one I've seen. They always start from a football pit, then end at a certain spot. I don't know, maybe that's the reason why the person thinks that the alcohol is good. Then the extra fat that the exercise couldn't take care of. But there's no basis to that.
There's no basis to that.
So
okay.
Alcohol is also one of the risk factors that could lead to diabetes. So if you consume a lot of alcohol, I think about 2 weeks ago we spoke about alcohol.
If you consume excessive alcohol.
Yes, that could actually help you out. We spoke about smoking too. Some may say that you don't smoke cigarette, but you do shisha. Of late, I think the shisha is getting 8 grams. Shisha, 1 puff is equivalent to 1 cigarette, piece of cigarette. So it means that your risk of developing diabetes is equally high. So it's best we listen to trained professionals who could give you the best of information to live a healthy life.
Okay. And then the gentleman who called asking about the symptoms, he wants to know what the symptoms for diabetes are.
So we mentioned earlier that there will be an increase in tests, like he's literally drinking a lot of water, and in the night too, he would be using the washroom more. So, if you are literally drinking more, but you still feel thirsty, sometimes your lips are even very dried. That's one of the signs, one of the symptoms. Then also increase in using the washroom. That's you are urinating more. You might not be drinking more, but you're urinating more. And you begin to feel hungry, like you've eaten like 2 hours ago, but you're still hungry. Like you crave for food a lot of times. So when you're craving excessively, eating a lot, you should check it. And the most important thing is to come to the health center, come to the hospital, because if we do not take your blood and check it, whether it's the random, whether it's the fasting, whether it's the glycated hemoglobin, to see your sugar level, you wouldn't be able to only you staying at home wouldn't be able to detect that you have diabetes. So it's important you visit the health facility, make use of the health facility, and most importantly, ask questions when you come to the health facility.
And the one about tasting your sweat.
So, just as
people say, "Oh, taste your sweat or taste your urine."
That is not a definitive to say that you're having diabetes. But just like we say, when you urinate in the house, or say it will be a late stage, because that means the glucose level, it might
really
be
high.
Yes, it's really high. So it's the same way with the sweating. So it's not a definitive thing test to know that you are having diabetes.
Okay.
Yes.
Okay, Doc, and the lady called asking about the
keloids.
keloid and its relation to diabetes.
Okay, so there could be a risk, because mostly when it comes to keloid, it's about genetic predispositions. That's the underlying factor. And then you can have diabetes, delaying wound healing and all that. Okay, so there could be a risk to that. But then you shouldn't be scared. You should just go in for further information and clarification. If she wants the keloids out, then the other way is either you wait when you're pregnant and then they are doing a CS for you. Then you go through the scar, they take off the scar. But then once you have a genetic predisposition, the new scar would also develop keloids. It's like that, because we have others who can have maybe 3 or 4 cesarean sessions, and then you see the scar is very, very thin. But others do have the hypertrophic scars and other things. So it's a genetic predisposition. Just that now there are newer medications, so the person can even opt for the traditional steroid injections. They even have creams that they apply, and then it sort of shrinks the scar. So she shouldn't be scared. She should just go in for further information or clarification.
All right. So it's important that you get further clarification. It's important that you also, if your doctors advise you, I think one of the best ways to also understand what's happening with you is to get advice from your doctor. Like I was saying about the Marie Stopes aspect, no, not your friend. Your friend is not a doctor. Even me, I don't like giving my friends advice because they don't pay me for it. They don't pay me for it. Anyway, we're 2 minutes to 10 o'clock and we're just about to end the show. Any final words before you go? I'll start with you, Doc.
Okay, so maybe they'll talk about that, but at least one thing I noticed is that the education aspect of diabetes. I've seen patients who come in, they have diabetes for like 15 years, and then you ask them their habits and you realize they don't really understand the disease pathology. Some of them, it could be that one, maybe it wasn't really diabetes, because sometimes there could be misdiagnosis at the initial stage. Maybe just a transient hyperglycemia, and then the person is put on metformin, and then the person thinks that, I have diabetes. Okay, but then those with the diabetes, I would urge that they should at least engage the health workers them more. I know clients who come to the diabetes clinic, they'll come in late. Why? Because they know that but then they've forgotten that most often than not, they do their health education at the initial stages. So if you come in late, you miss a very huge chunk of the information. Another thing too is about the dietitian consult. So somebody may have diabetes, but then you realize as time goes on, even depending on their economic status, levels change. So maybe their taste for foods and other things, maybe their work, for instance, previously maybe they were working more frequently, now they have cars, the least then they are virtually in their car driving and all that. Okay, so the risk factors are there, the sedentary lifestyles as well. So we are encouraging that patients should be well informed about their conditions, and then they need to accept that diabetes comes and it comes to stay. But then it's just like any other condition. It all depends on you, the patient. You are the best person to manage your health. We, the doctors and the health workers, we are there to just guide you. Okay, and when it comes to the management, most often than not, the first thing they do is just the diet and then the exercise or the lifestyle modification. For some people, they have the pre-diabetes. Okay, they have the risk of getting diabetes. If care is not taken, they will progress to getting frank diabetes. So when you tell them to institute these health lifestyle modifications, the exercise, the diet, sometimes they have the reversal of the glucose levels, and then they become normal. Okay, so at least once they should be able to go to the hospital almost every now and then. That's one thing we Ghanaians don't like, going for medical screening. Unless they have symptoms, unless they have pain, okay, unless they are seeing weight loss, they won't go. Okay, and then sometimes they might even have diabetes. They go somewhere, they tell them their BPs are high, and then they'll be like, oh, Oman can't she be, and now Indonesia and Oman Casamins are emergency. That ends it. So we are saying diabetes, hypertension, high levels of cholesterol, they are like siblings. If you have one, you can have the other. Okay, so we encourage that at least as much as possible, one, they should accept that they have the diabetes, and then their diet and exercise is very, very key. Then I would end by talking about the complications. Okay, that's one thing is about the eye screening or ophthalmology or something. They should go for an eye screen, a detailed eye screen. Because most often than not, the complications with the eye and even the kidneys, it takes a very long time before it manifests. By the time that it manifests, there's virtually little you can do about. Okay, so we encourage that at least for the first time that you have been diagnosed of having diabetes, you should go for an eye screening. And then based on the findings, the ophthalmologist will tell you the number of times you should even be coming, or based on even your complaints. And then they should also be doing a routine kidney function test, because you're able to pick up some of these abnormalities at the early stages to prevent a situation whereby you may have a full-blown end-stage kidney disease. In that case, it becomes difficult because getting replacement therapy is very difficult. And even when it comes to dialysis, it's very, very expensive.
It's quite expensive.
And sometimes not virtually sustainable. So diabetes can be managed, and then it has to be detected early enough. And adherence is very key. Sometimes side effects of the medications. We know insulin has its own side effects. I know someone who doesn't like insulin because they insulin they wouldn't want to do that. But then once they are educated, they will get to know it's about differences, individual differences. So it's all about education.
All right. Marilyn.
Yeah, I would like to say we have 8 life essentials, and I mean he has mentioned some, but I would want to say that if you're smoking, the best thing is to cease smoking. That's one. And secondly, you should be physically active. So like 30 minutes in 5 days or 30 minutes in a day, you should be physically active. Then thirdly, you should get if you're diabetic, you should get your sugars under control. If you're not hypertensive, so we should get your blood pressures under control, your sugars under control, your cholesterol too under control. And also you have to reduce the limit of taking in alcohol. You shouldn't take excessive alcohol. And lastly, you should have enough rest, especially if you're a diabetic, because if you tend to stay up late, you tend to be hungry more. So you should try as much as possible to have enough rest. And enough rest, if you're having sleep apnea, like you're snoring and all those things, and it's disturbing your sleep, you should see your medical practitioner so that it could help you through that. And secondly, I would say that having diabetes or hypertension it's challenging, it's tough, especially taking the medication, and you need support. So the support you need is telling your friends. Don't be afraid to tell your friends about it. Don't be afraid to tell your family members about it, because they can help you to be accountable to your medication. They can help you to be accountable to even the diet, the food you eat, because even healthy eating is one of it's part of the 8 essentials. So eating healthy, see a dietitian so that it could give you a strict diet and help you. Lastly, to Kidney Health International is having a free health screening at Ejuso on the 19th of November, and every one of you is invited. So we'll be talking about diabetes, and also you would meet doctors to consult with you so that you could talk about your medical conditions. Thank you.
All right, Patrick.
Yes. So I think a lot has been said.
Yep.
But then when you are seeking for information, you should go to the right people for them to give you the right information.
Right advice.
It's worrying to pick wrong information and then use it for a very long time and not get to know the truth. So please, when you are asking questions, please ask from those who really understand what it takes to give you the information. That's why Sport Stroke Fast Foundation too is online. You can visit us on Facebook, Sport Stroke Fast Foundation. We put a lot of information there. Our website too is sportstrokefast.com. You can also read a lot there. If you want to talk to any health personnel, our numbers are there. You can pick any of the contact and call and ask any question related to any of the risk factors we've spoken about, and we are ever ready to give you the information. Please, if you are having any medical condition that require that you visit the hospital maybe every month or every 2 months for checkup, please do so. Please don't stop your medications without your doctor's advice. Kindly do so and stay healthy.
All right. And And that brings us to the end of our show. We're here every Saturday from 8 a.m. to 10 a.m. and here we talk health. My name is Dr. Kwesi Jima. I'll be here next week Saturday between the hours of 8 o'clock and 10 o'clock. Enjoy your Saturday.